Hi there, everyone. Welcome. Today, we're going on a very special mission together. Think of it as a body detective mission. You know, it's pretty surprising, but a lot of cancers actually start with tiny, quiet warning signs that, honestly, most of us just brush off or completely ignore. They might seem, well, totally harmless at first glance. But catching these clues early, that can absolutely save lives. So in this explainer, we're going to dive right into understanding those subtle little hints our bodies drop for us. We'll uncover the very first signs of cancer that so many people miss and really talk about why tuning into your own body is literally one of the most important things you can do for your health. Let's get started. Welcome to our channel, Learning with AJ7. Grab a seat and let's learn together for a few minutes. I am just so thrilled to have you here with us for this super important explainer. Seriously, paying attention to the tiny changes in our bodies is such a powerful tool we all have right at our fingertips. By the end of our time together today, you're going to be fully equipped with the knowledge to spot those little warning signs that, let's be honest, we usually just shrug off. Every good detective needs a trusty roadmap, right? So here is our plan for today. First, we'll talk about what cancer actually is. Second, we'll look at whole body and surface clues. Third, we'll dive into internal clues. And finally, taking healthy action. We'll break it all down step by step. So don't worry, we've got this. Okay, moving right into section 1. What is cancer? Let's quickly cover the basics. So, to put it simply, cancer happens when some cells in your body kind of go rogue. Basically, they just start growing out of control. Instead of stopping when they normally should, these unhealthy cells just keep on multiplying and multiplying. And when they do that, these overgrown cells can sometimes form lumps, which are called tumors, or they can even spread. But hey, here is the absolute most important takeaway. Finding cancer early gives you the absolute best chance for successful treatment. It literally gives doctors a massive head start. There's this really beautiful, simple truth we need to remember. Your body speaks to you. The tricky thing is, a lot of people feel perfectly fine in the really early stages of cancer. Those very first signs, they're usually incredibly small and super easy to overlook. And that's exactly why doctors really want us to act like detectives for our own bodies. Because if you know what's normal for you, you're going to notice when something changes, even a little bit. And those tiny changes, well, they can sometimes tell an incredibly important story. That brings us to section 2, whole body and surface clues. Let's look at some of those external warnings. All right, so a huge part of our detective work is recognizing full body warnings. For example, have you suddenly lost several kilograms, but you haven't been dieting or working out more? That unexplained weight loss is definitely a clue. Or what about constant tiredness? Look, we all get tired. I know I do. But if you're feeling constantly exhausted, even after a really good night's sleep, your body is sending a signal. The same goes for persistent pain that sticks around for weeks or having night sweats with a fever you just can't explain. Now, I want to be super clear and reassure you here. A lot of the time, things like pain, tiredness, or weight loss are absolutely not cancer. But as smart body detectives, we know it's always the best call to check in with a doctor if these things pop up out of nowhere. Now let's talk about lumps. Finding a lump can be really scary, but it absolutely does not always mean cancer. Actually, a lot of lumps are completely harmless, super common, and they just kind of disappear on their own. But you do need to keep an eye out for warning lumps. Basically, any brand new lump that grows, changes shape, or just refuses to go away, that needs to be checked out. This is especially true for any new lumps on your neck, underarm, testicles, or breast tissue. And yes, both men and women need to be checking themselves. Getting it looked at early by a doctor either gives you instant peace of mind or, if you do need treatment, lets you start it so much sooner. Keeping our detective hats on, let's take a look at the surface. You've really got to watch your skin carefully. Say you have a mole that starts changing its size, shape, or color, that definitely needs medical attention. The same goes for any sores that just won't heal or weird patches on your skin. We also need to be on the lookout for things like unusual dimpling on the skin of the breast or any unexpected discharge. Oh, and one more big one, swollen lymph nodes. They're a totally normal part of your immune system and they swell up when you have a common cold. But if they stay swollen for weeks without getting better, especially around your neck, armpits, or groin, it's definitely time to let a doctor take a peek. Often, your skin is the first thing to tell you when something is shifting on the inside. Hey, real quick, before we dive into the internal clues, I just want to take a brief moment to say, please like, comment, share, and subscribe to our channel. If you're finding this explainer valuable today, your wonderful support really helps us create more of these educational explainers, which could honestly help improve lives all around the world. All right, let's keep moving. Section 3, internal clues. What's happening inside our bodies? So let's look at the mouth and throat first. Now, we all know most coughs or sore throats are just pesky little infections or allergies, right? But if you have a persistent cough that hangs on for weeks, especially if you're experiencing chest pain or coughing up blood, that absolutely needs to be evaluated. The same rule applies to an ongoing hoarse voice that just won't clear up, which is especially important to watch if you're a smoker. Also, if swallowing your food starts to feel difficult or painful for weeks at a time, or if you spot any unusual white patches or sores in your mouth that aren't healing up, that is your body waving a little red flag and asking for help. Again, it doesn't automatically mean cancer, but these specific clues definitely need a doctor's evaluation. Moving a bit further down our internal checklist, let's talk about bathroom habits and unexpected bleeding. I want to gently remind you that long-lasting changes, like dealing with constant constipation or diarrhea for weeks, are really important clues. And on top of that, any unexpected bleeding should never, ever be ignored. Whether that means coughing up blood, noticing blood in your stool or urine, or experiencing unusual vaginal bleeding, you have to pay attention. Sure, there are tons of common, everyday conditions that can cause these things, but this is your body's way of trying to communicate with you. Having a doctor investigate these signs nice and early makes a tremendously big difference.
Okay, let's shift gears to something really empowering. Section 4, taking healthy action.
Any truly great detective knows you have to look at the history of a case, right? Well, knowing your family's medical background is incredibly helpful. Since some cancers do run in families, sharing that history with your doctor helps them figure out if you might need to start your health screenings a little earlier than usual. And here's the thing, even if you feel 100% perfectly healthy right now, getting those regular health checkups can spot potential problems long before you'd ever notice a single symptom. Now, while it's true that not all cancers can be prevented, you still have an incredible amount of power over your own well-being. It's kind of like having a superpower. Let's walk through a few actionable, healthy lifestyle choices that actively lower your risk. Number 1, eat plenty of fruits and vegetables. 2, get regular exercise. 3, completely avoid tobacco and try to limit your alcohol intake. 4, protect your skin from excessive sunlight. Don't forget that sunscreen. And 5, definitely attend all your recommended cancer screenings. These are just everyday, simple actions that build a really strong, healthy foundation for your body. So let's establish the ultimate golden rule of our body detective mission. How do you actually know when it's just a regular, normal illness versus time to call the doctor? Well, normal illnesses usually improve after a short little while. But, and this is a big but, if you have any unusual symptom that lasts for more than 2 or 3 weeks, or if it starts getting worse, you need to make a medical appointment. Please never ignore persistent changes just because they don't hurt. Getting checked early does not automatically mean you have cancer. It simply helps your doctor find the real cause so you can get back to feeling like your amazing self. As we wrap up this explainer, I really want to leave you with a final, empowering question to think about. What is your body telling you today? Your body is talking to you every single day. We just need to listen carefully to the small changes it might be showing us. Taking early action can save lives, reduce suffering, and give doctors so many more treatment options if something serious is going on. At the end of the day, you are the absolute best detective your body has. Please share this vital knowledge with your family and friends. Seriously, one simple conversation about this might just be the push someone needs to seek medical care right in time. Thank you for watching Learning with AJ7. Please like, comment, share, and subscribe to our channel. Stay healthy, stay informed, keep being those amazing body detectives, and we'll see you in our next explainer.